Hello, this is a presentation of the 2019 Ucare Group Medicare Plan. Ucare serves more than 80,000 Medicare members across Minnesota and western Wisconsin. For more than 30 years, we have been serving members on public programs like Medicare and Medicaid, so you may not know us. Our members, however, do know us, and they rate our Ucare plan 9 out of 10 in satisfaction. We are a Medicare Advantage plan. You need only show your Ucare card at the doctor's office when you're on our plan. You may have heard that Medicare cost plans are sunsetting at the end of 2018. Ucare is not a cost plan, so our plans will continue to be the same into 2019. Our members don't have the only say in how we're rated. Medicare rates plans independently on a 5-star rating system in 5 service categories. Ucare Group Medicare has been and continues to be rated 4.5 out of 5 stars. Who can join Ucare Group Medicare? Education Minnesota retirees and their spouses who have Medicare Part A and Part B, live in Minnesota or within 26 counties in Wisconsin, and do not have end-stage renal disease. Those with end-stage renal disease have a special Medicare plan that they can use to get their coverage. You have a choice of 3 plans with Ucare Group Medicare. The high plan is great for someone who favors lower co-payments and would like rich drug coverage. That plan is $339 per month. The core plan at $175 per month has middle-of-the-road co-payments and a middle-of-the-road premium. The basic plan is a good plan for someone who doesn't go to the doctor much and is okay with paying higher co-pays to use services. That plan is $79 per month. The Ucare Group Medicare network is very large. In fact, 96% of those providers that are practicing in Minnesota are within the Ucare network. Those clinics include Allina Health, CentraCare, Essentia Health, Fairview, Health East, North Memorial, Park Nicollet, Stillwater Clinics, U of M Physicians, and of course the Mayo Clinic. Did this bright slide get your attention? It's to tell you about the features of the Ucare Group Medicare plans. All 3 plans include preventive services at no copayment. That would be your annual physical and routine tests like a colonoscopy or mammogram. Our plan also includes preventive dental at no copayment. All 3 plans include Medicare Part D, so you'll get your prescription drug coverage through these plans. The medical out-of-pocket maximum on all 3 plans is $3,400. You will choose a primary care clinic while on this plan. You can find your clinic in the primary care clinic listing, which is in each of the enrollment packets. You can change this clinic anytime, and this is just a home base, but you do not need to have this doctor sign off on seeing any specialist. A primary office visit is a $15 copay on all 3 plans. Let's say that you get admitted to the hospital. That will be covered at 100% after a copayment. On the high plan, that copayment is $100. On the core plan, it's $200. On the basic plan, the copayment is $300 per day, days 1 through 5. While you're in the hospital, you will be visited by countless providers. We take care to coordinate all of those services for you so that you can focus on getting better and going home. Now let's say you have a knee replaced and you need some rehabilitation. For the surgery, the copayment would be $200 on high, $250 on core, and $250 on basic. For that skilled nursing and rehabilitation after surgery, you can head into that right away because there is no 3-day inpatient hospital stay requirement in order to get that service covered on the Ucare plan. While in skilled nursing, you'll pay $0 for days 1 through 20. Most rehab services last about 3 weeks. If you need more coverage, you'll pay $100 per day for days 1 through 100. So what happens when you're on this plan and you need emergency medical services? You are covered. There is worldwide emergency care available to you through just a copayment, $50 for high, $75 for core, and $75 for basic. If your emergency room visit ends up with a hospital admission, then you pay the inpatient hospital copayment. If you need an ambulance to go to the hospital, that is also covered at 100% after a copayment. On the high plan, that's a $100 copay, as well as on the core plan. The basic plan has this service for a $200 copay. In addition to benefits you have for emergencies, you have benefits out of network for non-emergencies as well. You can use Ucare Anywhere, where you would pay the same copay out of network as you pay in network to see a primary care doctor, a specialist, an occupational or physical therapist, and even a mental health visit. You also have 80% coverage for non-emergency, non-urgent medical services anywhere within the United States. You can travel out of the service area up to 6 consecutive months, and there's no need to notify us of your comings and goings. Our plans have vision and hearing benefits. On the high and core plan, that vision exam you have where you get fitted for a pair of eyeglasses is $0 copayment. You have a $150 eyewear credit. Simply get your eyewear anywhere. Submit to us a paid receipt, and we'll send you a check for up to $150 each year. The hearing exam, where you would be fitted for a hearing aid, is also $0 copayment. There is a $500 hearing aid reimbursement every 3 years. The basic plan covers those vision and hearing exams as a specialty copayment of $40, and there is no eyewear or hearing aid credit on the basic plan. We have dental. You get those preventive dental benefits that I mentioned earlier of 3 cleanings, 2 exams, and bite ring x-rays every year for no additional cost. If you'd like, you can add additional dental coverage for things like fillings, crowns, and dentures with our rider for $21 per month. It includes a full mouth x-rays and a $50 deductible. It pays up to $1,200. All 3 plans include prescription drug coverage with Medicare Part D. The formulary is our list of covered drugs. You can search for your particular drug online by name and learn what tier it falls under: generic, preferred brand, non-preferred, and specialty. Ucare has a large pharmacy network and a mail order service through Express Scripts. We have some preferred pharmacies. Those preferred pharmacies include Walmart, Sam's Club, Cub, Costco, CVS, Lunds and Byerly's, and much more. At those preferred pharmacies, you'll get a 90-day supply of your medication for 2 copayments. More than 200 preferred pharmacies were added in 2019. Here is how the Ucare Group Medicare plan covers prescription drugs. First, you will pay an annual deductible. On the high plan, that's $100. On the core plan, it's $200. And on the basic plan, it's $400. However, if you're taking only Tier 1 generic drugs, you are not subject to meeting that deductible before you can start paying these low copayments. For those Tier 1 generics, there's a $10 copay for a 30-day supply on the high plan and a $12 copay on core and basic. For those Tier 2 preferred brand drugs, it's a $40 copayment for a 30-day supply on high and a $45 copayment on core and basic. For a Tier 3 brand drug, the copayment is $100 on all 3 plans. For a Tier 4 specialty drug, you pay 30% of the cost on the high plan and 25% of the cost on the core and basic plan. You pay these copays and coinsurance until the full cost of your drugs equals $3,820. If it has reached that amount, you have fallen into the Medicare donut hole. Let's talk about that in the next slide. More than 80% of our members never reach this gap. But here's how it looks if you do reach $3,820 in annual prescription costs and you've fallen into the coverage gap, otherwise known as the donut hole. With the high plan, you are covered just as you have been through the gap, There is no donut hole for you. This type of coverage for drugs can only be found in group plans. With the core plan, generics will be the same $12 copay through the gap, and brand names will cost you 25%. On the basic plan, you will pay the increased costs of 37% of the generic drugs and 25% of the brand name drugs. You will pay these costs until your out-of-pocket cost reaches $5,100. At that point, you've fallen into catastrophic coverage, and you'll pay 5% of the cost, or $3.40 for your generics and $8.50 for your brand names. Now let's talk about the fitness perks with a Ucare Group Medicare plan. You can join Silver Sneakers, which is a free gym membership to a fitness center near you. There are over 13,000 locations nationally, and you can use it anywhere you travel. In 2019, Bronze and Gold Lifetime Fitness Centers are included in Silver Sneakers. For those clubs that are not in Silver Sneakers, you can enjoy the Health Club savings, which is $20 towards a membership, reimbursed to you each month. On either plan, there are no minimum number of visits. You go as often or as little as you would like. How do you join Ucare Group Medicare? Contact us and we'll send you an enrollment folder. Retirees and spouses may enroll when they are Medicare eligible. The enrollment folders include 2 applications and 2 plan choice forms. Each retiree and spouse fills out their own application and plan choice. Spouses needn't be on the same plan. Simply mail the forms in the green envelope that's provided in the folder. That's it. Welcome to Ucare. Once you fill out an application and we process it, you'll get a confirmation of enrollment letter, as well as a member ID card. You'll have access to our customer service, and a Ucare nurse line is available to you for 24 hours a day, 7 days a week. We have several disease management programs that you may want to take advantage of. Also, you'll be able to log into the member portal at ucare.org. Do you have questions about the Ucare Group Medicare plan? Please give us a call. You can reach us at 612-676-6900 or call us toll free at 1-877-598-6574. Email us at groupsales@ucare.org. Also, visit our offices. We are available for walk-ins. Our address is 500 Stinson Boulevard, Northeast in Minneapolis. Thank you so much for your time today learning about the plan. We wish you a happy and healthy retirement.